Welcome to Health Source of Prescott, Arizona. Today's topic, studies link clinical depression with chronic back pain. Although it's been well documented in many medical journals, people still do not want to admit that back pain can lead to feelings of depression. Why people do not want to admit that prolonged pain can lead to low self-esteem and depression has yet to be determined. However, the facts remain the same. Prolonged back pain often leads to depression. Depression causes back pain. However, new studies are showing the reverse is also true. The University of Alberta did a study led by Dr. Linda Carroll. The study found that depression is a risk factor for the onset of severe neck and low back pain. She published her findings in the journal Pain. According to Science Daily, Carroll and her colleagues followed a random sample of nearly 800 adults without neck and low back pain and found that people who suffer from depression are 4 times more likely to develop intense or disabling neck and low back pain than those who are not depressed. This is an interesting finding, as many people have thought that depression was merely a mental issue. This study shows that depression may have physical symptoms as well as physiological aspects to the illness. Cycle of depression and back pain. One theory involves a spiral effect. It's believed that depression leads to loss of activity and isolation. The isolation leads to feelings of worthlessness. The feelings of worthlessness lead to more isolation, and the cycle continues. Eventually, the long periods of isolation and inactivity will bring about muscle weakness and joint pain. The minor pain will then escalate into fully fledged chronic neck and back pain. Chronic neck and back pain is shown to cause depression. This makes the vicious cycle of depression virtually impossible for the person to get out of without some sort of intervention. Missing the depression diagnosis with back pain. Unfortunately, those people suffering from chronic back pain and depression may not get the proper diagnosis. Oftentimes, patients with chronic back pain will only define the problem as back pain. They will never mention anything else that may trigger a doctor or a chiropractor to look in the direction of depression, because even the patient is not aware of the underlying depression. A study by Baio, Sturm, and Crowan in 2003 found that patients with chronic back pain and depression were 20% less likely to see a mental health specialist than those who were strictly depressed. It went on to say that those patients only being treated for back pain would take medication longer, and the depression would last longer than those taking simultaneous depression and pain treatment. Treating chronic back pain and depression. It is the view of many doctors that all chronic back pain patients be screened for depression. Then, if clinical depression is found, multidisciplinary treatments are used to treat both the chronic back pain and the clinic depression. Treatments include physical therapy, progressive rehab, massage therapy, spinal manipulation, medication, massage, nutrition, and possible surgery. To find out more information on topics like this, please go to www.arizona.healthsourcechiro.com/city/Prescott.